Thank you. Yes, HIV, not AIDS. My name is Adrian. I'm just going to repeat that because I'm just so proud that I have nearly finished. I've never put that before, and I think I've been saying it for about 6 months, but it's actually true this time. So I'm going to talk about my PhD, which I've been doing here for the last 3 years, and I'm nearly finished. Said that. And I'm going to try to summarize about 3 years worth of works in about 20 minutes, so wish me luck. And I just want to kind of pull together these 3 key topics that are the basis of my research. So HIV, why self-management is important, and how we can achieve it through personal health informatics, which sounds like a big fancy phrase. It really just means kind of like quantified self for normal people, or, you know, Fitbit, that sort of thing. So, fancy phrase, not really fancy though. So, HIV, why HIV? HIV is, in case you don't know or you haven't seen the posters, HIV is a chronic disease. It's not a terminal disease. It doesn't always lead to AIDS. That's why HIV is not AIDS. When it starts out, this is a little graph that I made for me to understand how it works. When you first get it, the virus goes all the way up in your body while your blood cells, your white blood cells, your CD4, go down. The virus starts to kind of like eat them, and then they eat each other, and that's not cool. And for a while, that was when people would kind of die. But now we have magical antiretrovirals, which are fantastic drugs, thank God for them, and they mean that they reverse the process where they kind of kill the virus off, and your CD4s come back, and now all of a sudden you're undetectable, which is really the best word. If you remembered nothing from my talk, I don't care. That's fine. Just remember undetectable, because that is what people living with HIV are now. If they're on medication, they're undetectable. They cannot pass on the virus. Good to know. So, okay. So the thing is, actually, living with HIV, you're going to be living with it for the rest of your life, and it's not just about taking those medications every day. You're not just taking your medications and checking your lab results. It's actually really, really difficult to self-manage. Only 1/3 of Americans that are living with HIV have succeeded in self-managing because it's really quite tricky. You need to constantly monitor your physical and mental well-being because there's all sorts of changes that are going on. And it's really all over the place. It could affect anything in your body. Your eyes can, kind of stop working. You might get neuropathy, lipodystrophy, which is where the fat kind of moves around in your body. There's all sorts of really diverse and ranging effects that either the disease or the medication can have on you, your body, and your mind. And it's not entirely always clear whether it is a side effect of the drugs, the antiretrovirals, if it's a symptom of having HIV, or if it's an age-related condition, opportunistic infection. It's really hard to identify where this change in your health is coming from. And this is a really, really big issue for people living with HIV. And that's why there's a need for self-management. There's a need to understand your own body, the changes that are happening, and try to be able to fix it, mitigate it, work around it, so that you can keep living a happy and healthy life. So actually, yeah, there's a good example I like to give here about one of the participants that I met in my first study, who was keeping track of all this information. She was having trouble sleeping, she was sweating constantly, she was very, very thirsty. She was really worried that actually this was a symptom of the virus in her body coming back, her medication not working anymore, and the virus is coming back, and she was going to develop AIDS, and she was very scared about this, only to find out that actually HIV is related to early onset menopause. So all of those symptoms of what she thought were AIDS are actually symptoms of an age-related disease that is caused by the virus. So that's why it's really important that people are able to self-manage and understand themselves so that they don't really you don't have that moment of fear, and you're not sure what's causing this change in your health or why it's happening. So in other conditions, notably diabetes, hypertension, and some mental disorders, there is a lot of technology available for people to self-manage by tracking their health, tracking their different symptoms or emotions, and reflecting on it with the aim of being able to understand themselves better. And a lot of this have been designed, I don't know if, I won't ask if anyone has diabetes, but if you look around, there's so many tools available to help people self-manage their diabetes. And that's really, really amazing. And most of these have been made with the end users in mind, whether or not they are involved in the research, involved in the design, the evaluation. But these tools are really designed and dedicated to what their needs are and continue to be evolved or changed to keep meeting their needs. But when you look at what is available for HIV, first, there's not really that much. These are some of the apps that are available. And if you look at what they do, they help you track your medication compliance. That's good, because taking that medication daily at the same time every day is difficult but very important. They help you track your lab results so you can see the changes in that good cell and the bad virus and the amount in your body over time, so you can actually see how well your medication is working. And you can track your doctor appointments, which is also very important. It's important to, check up and make sure that you're healthy. And then there's a lot of information available. So you can learn a lot about living with HIV or the virus itself, having safe sex, including U equals U, undetectable, and really important medication interactions, because there's so many things that affect the medication that make them not work anymore. So these are intended to help people self-manage. But it really, I would argue, I am arguing, it doesn't do what it's supposed to. This is not about self-management. That's just treating people from a certain perspective, saying that you have to just monitor your medication intake. You have to make sure you're undetectable, and you have to make sure you have safe sex. But that's not what living with HIV is. There's so much more to it. So self-management, the true definition, is about being able to manage the symptoms, the treatment, the physical and psychological aspects, and the lifestyle. And so these things really don't do any of that. They just kind of treat you in a medically patronizing point of view. They haven't come from any sort of user-centric perspective. It's not patient-centric. It's not empowering. It's really the opposite of what self-management is meant to be. It doesn't consider their day-to-day lives at all. So that's, I guess, what I wanted to do. I wanted to understand how technology can better support people living with HIV in self-management. And I wanted to do that by, as I think most people here know, you should approach problems by asking the users and doing research. So that was the obvious approach for me. So I want to start out by seeing what they're doing now, seeing what their issues are and how we can support them in reflecting on it and self-managing as a result. So I'm not going to go into details about the methods that I took. I'll just kind of talk about what I found, because I think that's interesting. Yeah. I was going to say that's much more interesting. I still think it's much more interesting. Anyway, it's going to happen. So I did do, as a first study, I did a bunch of interviews with 16 people living with HIV in England. And I wanted to know, why do they keep track of their health information? What is the point? What are they trying to do with it? And we found there that people have dual motivations. They are keeping track of their health information as a means of understanding changes in their health and seeing what changes, what they can do, what they can act upon to mitigate it, to mollify it, to work around it. And also they are keeping track of it to monitor their health. They're actually just really interested in having their own personal health record. They know, as this person's saying, they know that the hospital has all the records, has all the details, but they want that as well. They want to have that ownership. And that's exactly what self-management is about. It's owning your data and being able to understand how to act upon it and how to work around it. What do people keep track of? So if we think back to those icons that I showed you, which are all about lab results and medication, is that what they keep track of? Well, actually, there was a lot more. So the directly related information, a lot of people kept track of that medication, those lab results, but there was a lot of interest in keeping track of information that you might not think is obviously related to HIV. So indirectly related information, potential side effects, other conditions, things like that. And then potentially related, so emotions, weight, exercise. And this really, I mean, this just shows that there's such an interest in keeping track of way more information than just what those apps are giving them access to do. So we know that visualizations of data help people reflect, think back on their experiences, and therefore understand what they have gone through and draw new insights and understanding about their health. And so you would think that things that help them track their information will give them good representations of that information. But what we see is actually only 4 of the 16 people that we spoke to actually had any sort of representations of their health. And often it was just as simple as this, just a simple kind of chart, graph thing, that just shows their lab results. There's no other information on there. There's none of that, side effects or when did I miss my medication and how did I feel the next day. So this person here is actually taking it on herself to have a whole list and just keep that list on her phone. And that's sort of representation of her data that she has to look upon. And when and how do they reflect? So how do they look back on that data that they've tracked? And how do they try to get some sort of understanding out of it? We expect people to look on it by themselves. That's what we all kind of do. We have a Fitbit. We reflect on the amount of steps that we've taken and that sort of thing. But there's this massive, unexpected thing that came out of this study, which is the importance of the community. So people, and this is true for other chronic diseases, people will turn to their community and say, ooh, I had this weird experience. Is that true for you? Did anyone else have that? And it just showed that there was really an importance of community information and community interaction as a part of self-management, and that they were taking that data and turning specifically to online forums and sharing it to try to understand what they had gone through. So that led into the second study, which were to understand what they were going to the community to ask about, to understand. So this is an example of a community thread. I examined 200 threads in an online forum for people living with HIV to see if there were examples of people asking questions about their health and how the community tried to respond, to see if there was a way that we could bring that, what's already happening there, and integrate it into a sort of tool for tracking health information. So we found that 1 in 10 threads of the 200 were involved in people sharing their health information and asking about it, or actually, the community responding to it and trying to help people understand their questions. And this is an example. I took the time to underline all the different pieces of information that this person entered in. I don't even think this is her whole post. Every single underline is a detail, an important detail that she took the time to enter in there and that she's been tracking and physically entered to try to ask her community a few questions about her health. All of that detail. So imagine if you didn't have to enter that, you could just have tracked it already and share it. But more importantly, what are they asking? What are they trying to understand? the majority of the questions are about causation, trying to understand what caused a change in health, or was it this particular thing that caused a change in health? And a lot of time this was about medication. So why is my CD4 the good thing? Why is my CD4 still a little bit low? Or did HIV or the medication cause me to have high cholesterol? Does anyone else have examples of this? Does anyone else have this problem? Normalcy, thank you. I should speed up. Normalcy is about determining if what you have experienced is actually normal for other people, or if it's a bit cause for concern. So kind of checking where you're at against where they're at to see, if maybe this is a normal thing, normal for someone with HIV, or if you really should maybe go to the doctor to see something about it. And then understanding the future. So based on my current experiences, what's going to happen in the future? What can I expect? And this is about learning from other people's experiences to set your expectations for your own. Quickly about this, the information that they were actually asking about, so the information that they were trying to understand or reflect on, it wasn't just about lab results and medication compliance. It was about all sorts of different things. And again, those tools that are available, don't let them track those sorts of things or visualize the relationship between those different things. So just to give an example, so if we just tried to understand our lab results with this graph here, how would I know if that little blip there is normal? There's nothing to tell me. It's just a graph. It's not necessarily helpful. And we see that the community really does try to help and shares their information as a way of trying to help people understand their health. So, quickly, how can we support this? How could we take a tool, if people are tracking their data and they're wondering about their health, and they've already tracked it and they're entering it into an online forum, and then you have people who are also entering their data into the online forum to try to respond, what can we do? We need to make this easier. So let's imagine that we have a tracking tool where you're able to track all those details that you want to. That's not so hard. Other people can do it. How might we be able to help people talk to their community around that data? So I developed a couple of prototypes, and it's just about the idea that maybe you'd be able to see all of your health information in one place. Maybe you'd be able to ask your community a question and to see their health information and to see their responses. And it doesn't necessarily have to look like this. It could look like this. It could be, totally different. But how can we help people see their health and to see the health of other people and to converse with those people about it and not make it so difficult for them? That's really what I'm focused on right now. So after having 6 people kind of interact with these prototypes, I have some really great kind of quotes that I'll just close on because I like them. And it's just seeing that you're not alone. Having access to something that makes sense to you, that connects to you, that's personal. Wanting to have this in the health field, actually being able to understand it. This one feels uncomfortable for me, but it being, desired, a desirable thing, which just shows that we need to kind of work on this sort of thing and actually start listening to patients. And to know that it's empowering. That's really what it's about. Empowerment, patient empowerment, people empowerment, self-empowerment. That's really the point of the whole thing. So, remember the undetectable thing. And then if you want to remember one more thing, just remember that doctors are not necessarily always right. You really should always just ask people about what they need and what they want, and don't just take a perspective of, knowing better than someone else, because you really need to empower them and make them feel that they are part of a community. So that's that's it.
Thank you very much. Very well in time. We started a bit later, but you finished within your 20 minutes. So fantastic. Thank you very much. Does anybody have any questions for Adrian? Okay, we'll start with you and then we'll come to you second.
Hello.
Hi.
I actually didn't know that you were doing this.
Oh.
It's amazing. Yeah, so honestly, it's absolutely amazing. My sister has a chronic disease. Thankfully, it's not HIV, but I know how hard it is to track all of the symptoms. And as you said, medicine as such is a very patronizing field of work, usually and unfortunately. When you were doing your research, did you by any chance spoke with doctors and got their perspective on how they think it can be dealt with on a sort of mass level? Like if we were to go to the NHS and bring this, how would doctors feel like they could help, or would they feel a little bit like you're taking away from me what is my job?
Yeah, so glad I totally have a good answer to this. So part one is that I have actually presented this in front of HIV consultants. It was very awkward for me because I didn't know how they would feel with me saying this is medically patronizing. But thankfully they agreed with me. I wouldn't say it's true for all. Outside of HIV, I think HIV is a very different sort of community. But there is an interest in this, for sure, and in having the communities help themselves. And the second point is that I haven't done any of that research, but I will be starting a postdoc in September where I will be doing that. So I will happily actually be involving clinicians and seeing how this can weave into it. Great question.
And then you had a question up in this direction.
It was really interesting. Thank you very much. My question was around, so you were saying how they obviously know that doctors are capturing all of this information and stuff already. I imagine there'll be a whole other things considered if this was ever possible. But if there was a way for patients to always have access to that, would that actually be useful to them, or is it more about the fact that they are reflecting on it and documenting it themselves that is more useful, that process in fact?
Well, I'm not sure. One thing I do know is that when you track your own information, you're more connected to it.
Yeah.
So there's a deeper reflection that happens. But I still think actually there would still definitely be an interest in using the data that someone else has collected and conversing about it and sharing about it for sure. So, hey.
Do you know that the medical community has trouble with accepting information that is self-collected by people? But at the same time, wouldn't it be good for medical diagnosis and for medical treatment to have access to that information that is just coming from the patient itself?
Yeah, and so that's kind of, so actually with that last study where I really just asked people to give me their health data so I could make, pictures of it, I got a lot of questions from people saying, do you work for a pharmaceutical company? Who are you sharing this with? What is your research going to do? Because there's mixed feelings amongst the HIV community. Part of them are very I want to do anything I can to make medical advances. I will be a guinea pig. And then the other feeling is, hang on, these pharmaceuticals, they're kind of taking advantage of us. I don't trust them. They're charging too much. I don't want any part in sharing my data with them. So it's really also part of the postdoc that's going to be happening in September. So, great question.
I think we have time for one more if anybody else has a final question. Okay, in that case, can you join me in saying thank you very much, Adrian?